and today we have the pleasant topic of restraining psychiatric patients. In theory, in Germany, if patients are to be restrained for a time that would exceed 30 minutes, that is foreseen to be exceeding 30 minutes, this needs the authorization of a judge. Of course, in the meantime, the patients can be restrained. However, this is not a law, this is a court decision that was applied to a patient that was restrained in 5 points, which means both legs, both arms, and the stomach, let's say. And so what happens? If patients need to be restrained, they will usually skirt the rules by not restraining them in 5 points. I'm talking about mechanical restraints. Patients can be also restrained medically, or let's say restrained by being locked in a room. This, of course, ends up needing the authorization of a judge. However, another way, this is a theory. In practice, it depends a lot on the hospital. And depends because they don't really do what the law says. They can restrain patients for hours and write on a sheet that it was each time 25 minutes, and they tried to free them, but they were still aggressive or unruly or whatever. Also, what does aggressive mean? Aggressive can be anything. They can construe aggressive from just shouting or being loud or saying a bad word, and so really this really depends a lot on the hospital. If you're taken to a psychiatric hospital and maybe you don't follow the rules, you don't stay in bed, you walk around, which is something that you're allowed to do as long as you don't disturb anyone, they may eventually decide to restrain you. However, even if there is no real need for restraint, just because you're bothering them, so you have to be careful with that. Also, they don't know how to restrain patients properly. They might just restrain them, say one leg, one arm, and you will see that in some places they say this is very dangerous. In other places they will say this is perfectly fine. What else they do? They also will, of course, say it's very discomfortable to be restrained, and will give medication to make the patient fall asleep, which is like another extra restraint. In practice, if you happen to be in a German hospital and for some reason they want to restrain you because you're being, I don't know, noisy or moving too much or something, then there's nothing to do but comply. They'll get more nurses, and if you still don't comply, they will get the police to help. And then things start getting ugly because they will use more force. What happens in practice too is that the patient, when the police comes, the patient will be will see there's nothing to do, and will in effect be very adequate, be very nice, and will let himself be tied up, which of course, if the patient is calm and is not doing anything, this means he should not be tied up. Psychiatry starts getting very unfair. They start to see not what the patient needs, but what the hospital needs, what the ward needs. The patient might just be calmed down with a chat, but of course it's much easier just to restrain someone who's moving too much. There are, of course, those who need to be restrained because they're really dangerous, they're doing something, but usually this is a very short situation. Yes, it's not good news, but there it is.